Hello, my name is Sarah Gillen. I am president of Emergency Skills Incorporated. We are a CPR and defibrillator training programs and product company based in New York City. And in recognition of CPR AED Awareness Week, I am going to do a demonstration of hands-only CPR. Hands-only CPR is a safe and simple way that anyone can be prepared to save a life. Hands-only CPR is exactly how it sounds. I'm going to be doing just the compressions. So again, I can be safe. I'm not going to be doing mouth-to-mouth CPR, just the compressions. So there's two simple steps. The one thing you have to do is call 911, and two, begin compressions. So I'm going to do a quick demonstration and then we'll break down the steps and I'll explain them. So one thing that you're going to see that's a little bit different is that my patient is going to have a mask on. Realizing that we are in the middle of the COVID-19 pandemic, the American Heart Association is recommending that your victim have a face mask on as well. Because when you are doing the chest compressions, there will be droplets coming out during the exhalations of the victim. So we want to make sure that there is some cloth that's going to be capturing those droplets so they never reach you as the rescuer. So in this example I'm going to do, it's going to be me being out in the public. I'm out, for example, walking my dog in the morning. When I do that, I always wear a face mask. As I walk, somebody collapses suddenly in front of me. First thing is assign someone to call 911 for you. You, go call 911. Step two, begin compressions. And I would just keep on doing my chest compressions. I'm going to take a break now and explain to you what I did. So you can hear me, I will take the mask off. So the first thing, as soon as somebody collapses in front of you, particularly an adult, you know this is a major emergency. First thing you need to do is call 911. If there's people with you, ask them to call for you. If you're alone, pull out your cell phone and call yourself. Now again, in this case, because of COVID-19, I wanted to make sure that my victim did have a mask on, and in this case, he was wearing a mask, so we were safe. If he didn't have one, I would have found some extra piece of cloth, a sweatshirt or a t-shirt or a scarf or something so that you could cover up their mouth and nose to capture any droplets that might be coming out of their mouth during the exhalations while you're performing compressions. Now, the next thing you do is start compressions. How do you do compressions? Now in this case, I did get on a step stool. Typically speaking, your victim is going to be laying on the ground. It's really important that your whole body be able to be over the torso. You want the weight of your upper body to be doing the compression. That whole weight is what's going to give you the strength and the energy and the force in order to give a good quality chest compressions. So, stepping on my step stool, you're going to use the heels of two hands to do your compressions. So the heel of the first hand is going to go on the center of the chest. The heel is in line with the nose and the belly button of your victim. You're going to be on the lower half of the breastbone, roughly between the nipple lines. You take your other hand, interlock it with the first. Your fingers are going underneath the palm of your hand, and you're going to be pulling the palm of your hand off of the chest. You want the heels of the two hands to be doing the work. The force of your whole body is going to be focused on the heels of those two hands so you can do your chest compressions. You want your elbows to be straight and locked. You want your shoulders to be right over the chest, and you begin your compressions. Your compressions are going to be at least 2 inches deep, and you're going to do them at a rate of at least 100 compressions per minute. Now you may recall that there's a few songs out there that help you remember the beat. For example, Staying Alive is a great tune to help you remember. Also, I just learned that Justin Timberlake's Can't Stop the Feeling is a great song that you can do your chest compressions to, so you remember that beat. So again, we're gonna go down at least 2 inches at a rate of at least 100 compressions per minute. And you begin. When you go down at least 2 inches, you wanna make sure you come all the way back up. You need a full chest recoil. I'm pivoting from the hips. Again, I want the full weight of my torso to be doing the compression. And that's how you're gonna be most effective. Now, Doing compressions can be tiring. So after about 2 minutes, the American Heart Association recommends that you find another rescuer. You can see how easy this is. Anybody who's around you in the public can come and help you and have them take over for you. The studies have shown that CPR can double or sometimes triple the chances of survival for a victim of cardiac arrest. So getting a fresh rescuer every 2 minutes really helps to save this person's life until 911 arrives. All right, so I'm gonna do one more demo and then we're gonna wrap this up. I'm taking my dog for a walk. I have my barrier protection on. An adult victim suddenly collapses in front of me. You go call 911. Begin compressions. 1, 2. Going down at least 2 inches at a rate of at least 100 compressions per minute, making sure that with every compression, I come all the way back up so there's a full chest recoil. And you keep on going. You keep on going because you are this person's best chance of survival. Get people to come and help you and keep this person's heart and brain alive until EMS can arrive and take over. Thank you so much for being here today and listening to our demonstration of hands-only CPR. If you have any questions, please contact Emergency Skills. We can be found on the internet at emergencyskills.com. Thank you.